Today's post is going to be about peripheral neuropathy, and today we're going to be talking about how neuropathy is related to certain parts of the brain. In previous posts, we talked about the necessities to keep a nerve healthy, whether it be glucose, which is sugar, oxygen, nutrients, the absence of inflammation. We talked about some of the causes of neuropathies being cholesterol-lowering drugs, statins. We talked about type 2 diabetes or prediabetes. In other words, shifts in blood sugar can alter how a nerve stays healthy. And one of the most common neurological causes, besides mechanical interferences on the nerve, because there can be mechanical interferences at the spine, whether it be in your lower neck or in the lumbar spine, corresponding to both hand or feet neuropathies, numbing and tingling. But there's a part of the brain that's involved in giving you the proper information to allow your limbs to stay healthy. And that part of the brain is called the parietal lobe. In the brain, so you have the brain and the spinal cord. There's a part of the brain back here, and it's called the parietal lobe. The parietal lobe, which sits back here, is what is getting all the information coming in from the environment. It's getting all the information coming in from the joint receptors and the muscle receptors. It's getting information from your vision, your hearing. It's getting information from gravity. And the parietal lobe is the area that's getting all the sensory information coming in. And as a result of it starting to go into a state of demise or going south or starting to become ill, the parietal lobe will start to give not good information outward of telling you where your body is in space and time. So the parietal lobe gets all the sensory information, and when it starts to become hindered by whatever cause, it starts giving information that is more garbled. So you can think of the parietal lobe as having the maps to the body. So if your brain has a map of where your body is, and you can look at the map of the United States and see the borders between states would be very clear. That's a well-functioning parietal lobe. There's good boundaries. There's good delineations between one area of the map to the next, which state belongs to who. But when the parietal lobe starts to go south, it starts to get sick, the boundaries between your body parts start to get blurred. Just like the boundaries between states on the map of the United States start to get blurred, the parietal lobe will give altered information of what's going on in the body. So the parietal lobe can then, as a result of that situation, it'll give the nerves a feeling of this numbing and tingling, this feeling of pins and needles, or this feeling of this altered states. Paresthesia just means altered feeling or weird feeling. That's what paresthesia means. So it could feel like ants crawling on the skin. It could feel like you have a sock bunched up underneath your foot, like you have something in your shoe. Paresthesia can come in many different forms, and paresthesia can be driven by a brain issue, a part of the brain called the parietal lobe. So part of an evaluation, whatever doctor you're going to, the evaluation should include an evaluation of different parts of the brain, the different lobes of the brain, so that you can determine whether your paresthesia, your numbing and tingling, your neuropathy is coming from a brain issue versus something occurring in the spine or something occurring because of a metabolic issue like blood sugar issues, or you have high cholesterol and you're on statins, which can also alter how your nerves work, like we've talked about in other posts. So keep that in mind. Make sure the doctor is looking at parts of the brain so that you can be evaluated appropriately, and that way you can get to the bottom of why you have your neuropathy. So I'd like to thank you for watching, and make it a great day.